Hello everyone, this is Vamshi Krishna. Today we will see some of the important MCQs for upcoming staff nurse examinations. So I hope you all understand my classes and please subscribe to your friends who are all preparing for the staff nurse examinations. It really helpful for them and for you also. So let's see the first question. Non-pregnant women uterus weight. So in the case of pregnant women, and it totally different to the non-pregnant woman. So what is the normal weight of the uterus in non-pregnant woman when she is not conceiving or when she is not carrying any baby in the womb? Options are: option A 60 grams, option B 80 grams, option D 90 grams, option C 90 grams, option D 65 grams. The right answer is option A, that is 60 grams. So in the case of non-pregnant women, her uterus, here you can see the uterus. This is female reproductive system, and we have the uterus here and cervix here, and this is the vagina. So we have the ovaries, the two ovaries over here, and the connection between the ovaries and uterus is called fallopian tubes. Okay, so in the case of non-pregnant women, the uterus weight is 60 grams. Let's move to the next question. So what is the sequence of neonatal resuscitation? So by seeing this picture, you can understand the resuscitation. Someone is resuscitating the child. So this is a dummy child. Okay. So someone is doing the ambuing. Ambu is nothing but giving artificial air. So what is the sequence while doing the neonatal resuscitation? The options are: option A, A B C T, option B, C T A B, option C, B A C T, option D, T A B C. So you can understand these letters. That is, A means airway, B means breathing, C means circulation, T means temperature. Okay, so what is the sequence? The right option is option D. Option D is the first temperature, second airway, and third breathing, and fourth circulation. Okay, so whenever the baby is in emergency condition, first of all you need to assess for the temperature. Okay, so the temperature is most important in the neonates. Why? Because the heat loss is very easily, they will lose the heat to the environment or in a cold environment. So firstly you have to check for the temperature and then airway. Okay, so if it is there any obstruction or any mucus obstruction, secretions, so you need to remove the secretions from the airway, then only the air can go inside the lungs. And next, breathing. So when whether the baby is doing is taking breathing or not, we need to check. And after finally circulation. So by doing due to all this sufficient manner only, the circulation will be taking place and the baby will be normal. So that is the temperature, airway, breathing, and circulation. So the next question is, what is the final element of blood coagulation? Okay, so you all know the process of coagulation. Okay, there are some different types of factors will involve in the process of coagulation. So what is the final element? So what is the final product will taking place in the coagulation process? The options are option A thrombin, option B prothrombin, option D fibrin, option C fibrin, option D thromboplastin. So the right answer is fibrin. Okay. So if you see the picture over here, so here we have the cell damage or any skin rupture or blood vessel rupture. So immediately what will happen? All the RBCs come together and making a clot. Okay, that is called blood coagulation. So in the coagulation process, the final product is the fibrin, and in the coagulation method, in the coagulation process, we have the activated plate cells, and it will form the clotting. So when blood is clotted, the blood loss will not occur. So due to that reason only, the blood will clot with the different types of factors. So the next question is bluish discoloration of cervix as a nurse, understand the feature. So when the patient comes to you and you have done the pervaginal examination, and you found that the cervix, okay, so this is inside the vagina. uh, so this is the vaginal walls, and here you can see the cervix. So the cervix is looking abnormal. So we will see options over there. First option is Jacomer sign. Second option is Hagar sign. Third option is Chadwick sign. Fourth option is Goodell sign. So as a nurse, which sign is belongs to in this clinical feature? The right option is option 3. Chadwick sign. So the Chadwick sign is nothing but bluish discoloration of the cervix. So if you do the any per vaginal examination when the mother is in early pregnancy, you will find this kind of structure. Okay. So in a normal condition, the cervix will be light pink color, and you can see the orifice over here. So in the case of early pregnancy stage, the mother will have the bluish discolored cervix. Okay. So we will see some of the types of signs over here. First one is a Jacomer sign. So what is the meaning of Jacomer sign? It is a purplish discoloration of the mucous membrane of the vagina that occurs in early pregnancy. So in this sign, we have the purple discoloration of the mucous membrane of the vagina. So the vagina wall will be there. So like that, in the vaginal wall, there will have the blue purplish. Okay, purplish discoloration. So that is called Jacomer sign. And the next one is the Hagar sign. Hagar sign is a non-specific indication of pregnancy. Okay. That is characterized by the compressibility and softening of the cervical isthmus. So you all know the cervix, okay, and this is the vaginal wall, and here we have the uterus. Okay. So if you think it is a uterus, here we have the cervix, and this is the vagina. So, what is the meaning of Hagar sign? It is a softening of the cervical isthmus. Okay, so the cervix over here, the tissue which is present, mucous membrane, whatever the tissue is over here, this tissue will become very soft. Okay, so that is called Hagar sign. And the last one is Goodell sign. It is refers to a probable sign of pregnancy. So it is called Gödel sign is nothing but a probable sign of pregnancy. Characterized by softening of the cervix, a positive Gödel sign occurs due to the increasing of blood flow through the flow noted in the cervix during the 4th to 8th weeks of pregnancy. So due to the overflow of the blood to the cervix, so it will become what will happen, the cervix will become very soft. So that is called Gödel sign. I hope you all understand what is Jacomer sign, Hagar sign, and Gödel sign. Don't be confused. And the next question is, bleeding from the nose is known as. You commonly know this type of conditions you may have seen in the children or in the adult, mainly in the summer season. Okay, during the summer, commonly we will find this kind of cases. So the first option is hematemesis. Second option is the epistaxis. Third option is the rhinorrhea. Fourth option is the hemoptysis. So what is the condition of this picture? So here you can see the child is bleeding from the nose. So what is the name of this condition? The right answer is option C. It is nothing but, sorry, it is wrong. Option B is the right answer. That is epistaxis. Epistaxis is nothing but bleeding from the nose. So, from the nose, when we see the bleeding due to the rupture of the blood vessels which are present in the nose, internal nose, okay. So, there we have the very softened capillary blood vessels due to the increasing of body temperature. So, the capillary blood vessels will rupture and it leads to the bleeding from the nose. This condition is called epistaxis. So other other abbreviations are here. Hematemesis is a bleeding in the stomach. So hematemesis is nothing but bleeding from the stomach, and hemoptysis is nothing but bleeding from the lungs, and rhinorrhea is commonly we know that running nose. During the cold, when we have the allergy or something, we commonly will see the running nose. That is nothing but rhinorrhea. Hematemesis is a bleeding from the lungs. Hematemesis is nothing but bleeding from the stomach. So the next question is, Cooley's anemia is due to the cause of. So what is the meaning of Cooley's anemia? So anemia are several types are there. So among those, what is Cooley's anemia? The options are option 1, vitamin C deficiency, option 2, vitamin B12 deficiency, option 3, abnormal hemoglobin beta chain, option 4, abnormal hemoglobin alpha chain. So in the case of Cooley's anemia, what is the defect in the patient? The correct one is the option C, that is option third one, abnormal hemoglobin beta chain. So due to the abnormality in the beta chain of the hemoglobin, so it leads to the Cooley's anemia. And the next one is the intramuscular injection given in the angle of. So commonly we will give the injections for the patients daily routine. Okay, so while you giving the injection, how much degree how much degree of you are inserting the needle into the body? The options are option 1 90 degrees, options 2 30 degrees, option 3 45 degrees, option 4 15 degrees. The right option is option 1 90 degrees. So in the case of IM injection, we need to insert the needle in 90 degrees. Okay. So during in the case of intramuscular injection only, we give the injection in 90 degrees. So the next question is, Ray's syndrome is caused due to. So Ray's syndrome is a type of syndrome. Ray's syndrome is a type of syndrome. Syndrome is nothing but a group of disorders. Okay. So there is a difference between disease, disorder, and syndrome. So disease is a acute nature. Disorder is due to the deficiency or any damage. Okay. So due to occurring of the uh, deficiency, it will come like that. And syndrome is nothing but a group of disorders. So disease, deficiency, and syndrome. So here we have the Ray's syndrome. So when it will develop Ray's syndrome in the case of, the options are option 1 aspirin, option 2 nitroglycerin, option 3 diclofenac, option 4 amoxicillin. The right option is option 1. So when the patient is taking or is under the aspirin treatment, so the patient can develop the Ray's syndrome. Okay. So Ray's syndrome is caused due to the aspirin intake. So the next question is, in the condition of erythrocytopenia. So the patient is having the erythrocytopenia. The nurse should assist for the, so as a nurse, okay, so as a nurse, what you should assess for the patient. Okay, in the case of patient with erythrocytopenia, as a nurse, what you need to check. The options are option 1 cyanosis, option 2 bleeding, option 3 weakness, option 4 increased intracranial pressure. So what is the right answer? Option 3 is the right answer. Why? Because option 3 is the right answer. Why? Because in the case of patient with erythrocytopenia, erythrocytopenia is nothing but decreasing of RBC. So when the patient having lack of RBC in the blood, what will happen? The oxygen will not reach sufficiently to the tissues. So what will happen? It leads to the abnormal metabolism. So when the patient having the abnormal metabolism, it leads to the low energy, low energy and weakness. So the right option is a weakness. Weakness is the right option. In the case weakness is the first first symptom, and we need to check for the weakness in the case of patient with erythrocytopenia. The next question is scurvy. Scurvy is a type of deficiency. Okay. So scurvy is caused due to the deficiency of. So how we get the scurvy deficiency? The options are option 1 vitamin B, option 2 vitamin C, option D vitamin D, option C vitamin D, option D vitamin K. The right option is option C. C is nothing but vitamin C is nothing but ascorbic acid. Okay, so due to the lack of vitamin C in the body, what will happen? The person can develop the scurvy deficiency or scurvy disorder. So scurvy is a disease caused by the serious vitamin C deficiency. Okay, vitamin C deficiency, not eating enough fruits and vegetables is. So fruits and vegetables are the main cause, main uh, source of vitamin C. So due to the not eating enough fruits and vegetables, it leads to the development of disease, that is scurvy. If it is not treated, the scurvy can lead to the bleeding gums, loosening teeth, and bleeding under the skin. Okay, these are the symptoms in the case of scurvy. So, what is the treatment for that scurvy? Treatment for the scurvy condition includes the getting plenty of vitamin C in your diet. Okay, so vitamin C consists of which type of fruits? Citrus fruits. Citrus fruits are nothing but lemon, orange. Okay, so in this kind of fruits we can find the vitamin C. When we take the sufficient vitamin C in our body, we can prevent the occurrence of scurvy. So thank you guys, this is the end of my class. I hope you all understand, and please subscribe and share with your friends. Tell them to subscribe. Please support me.